The title of this paper is Potential Application of Rapid Social Impact Assessment to Manage COVID-19 in Sabah. First of all, we would like to acknowledge the funder, Universiti Malaysia Sabah under the Dana Khas Penyelidikan COVID-19. The title of research is Potential Application of Rapid Social Impact Assessment to Manage Pandemic COVID-19. Our co-researchers are Professor Dr. Razasman Hussein, Dr. Kolonius Atang, Dr. Ramzi, and I am leading this research. As an introduction, the current situation due to the pandemic COVID-19, various policy, program, and projects were imposed. Those policy, program, and projects has affected various groups of communities. Unfortunately, our preliminary finding shows that no proper tools were used to assess the social impact of those policy, program, and project prior to its implementation. Therefore, the objective of this research is to assess the possibility of using rapid social impact assessment to manage the pandemic COVID-19. Method used in this research are a combination of qualitative and quantitative. Our target group are individuals of public sectors, private sectors, small and medium industry, farmers, and fishermen. And data collection were through survey questionnaire, in-depth interview, field investigation, and participant observation. Our instrument for the data collection was through survey questionnaires, field notes, photographs, and videos. And thereafter, we analyzed those findings using themes, cross-tabulation, scoring, perception map, and scoring based on severity of impacts and field notes. Based on the research, preliminary result of this research reveals a very interesting finding. From the policy, program, and projects imposed during the movement control order, it has affected various segments of communities in number of ways. For example, the interstate travel required permission from police station. Now, this policy has attracted a crowded gathering at the police station, and this further aggravated the possibility of spreading virus at the police station. Therefore, this policy was revised. The second example that we have found is the various government assistance. For example, it was agreed that citizens are allowed to withdraw the AVF from account 1. Now, we have found out that contributors without the ILS-TARI account need to present its AVF counters during MCO. And this has contradicted with the directive of no movement during movement control orders. The third example that we have seen is the Bantuan Sara Hidup, which is channeled through banks, especially the Bank Simpanan Nasional. Now, in order for the citizen to withdraw, especially in a smaller town where you only have one bank, we have found out that gathering in long queue happens at that particular banks. And should proper management in place before that directive was given, it has or should have been prevented the long queue and gathering at that particular banks. And the fourth example that we have found out is the restriction movement during the movement control order itself. Now, it has affected various segments of government agency as well as population. As an example, education institution, for example, both teachers, lecturers, and students face severe problem in terms of online teaching and online learning, especially due to lack of internet access and lack of resources, especially in the remote areas. We also found out that lack of economic income in the rural areas due to limited business operation has contributed to the shortfall of learning through online media. Some of those social impact could have been prevented if rapid social impact management plan was in place and run prior to implementation of program, policies, and projects. We have seen on the ground, for example, various unsatisfied citizens give feedback to the government in various ways. For example, on the left photo, penduduk Lahadatu bantah lanjutan PKPD. On the right side is a photo with related to gathering at the police station, which resulted in a panic after interstate ban was introduced. Another 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 example, directive with regard to what to do at the pump station or petrol station. There was confusion whether to register or not register, and thereafter damage control was broadcast through SMS as shown in this slide. In conclusion, rapid social impact assessment should have been conducted prior to implementation of government policy, programs, and projects. SIA able to mitigate negative social impact faced by various segments of communities, and social impact assessment are useful tools to provide social impact management plan, which is anticipated from the program, projects, and policies. And finally, social impact management plan are capable of providing social audit mechanism. Therefore, this paper advocates that social impact management plan should be implemented and should be approved in place prior to implementation of policy, projects, and program. With that, I end this presentation and thank you very much.